you one of the many people growing tired of following the COVID-19 guidelines? Yeah, lots of people sick of it, but you got to do it. Joining us now to talk more about this is emergency medicine physician Dr. Owais Durrani out of Houston, Texas. Dr. Durrani, thank you so much for joining us. Let's talk about the confusion that is going on. The CDC is expected to relax masking guidelines this weekend. And then the FDA is predicting a fourth COVID booster will be needed come the fall. It's hard to know exactly what you should be doing right now. What do you recommend for people to stay safe?
Yeah, thanks for having me. I think, as a physician, every time a patient asks me about anything, we go over the risk and benefit of that tool, that medication, that decision. And right now, the transmission rates of COVID-19, even though they're heading in the right direction, are not exactly where we need them to be. And so the risk is still out there. The risk of wearing a mask is essentially zero, and the benefit is multifold if you're wearing that N95 mask that protects you. And so I think if you are at home and confused and getting mixed messaging from social media versus one news channel versus one health agency, the safest and most appropriate option is going to be wearing a well-fitting, high-quality mask, making sure that those around you are vaccinated, that you're boosted, and that if you're around kids, whether they're your own kids or they're your nieces and nephews, right now our vaccination rates in that 5 to 11 age group are pretty abysmal. Getting a way to get them vaccinated so that schools can stay open and so that we can continue that path to normalcy.
Yeah, we all want to go back to normal if there is such a thing. But, doctor, what's it like for you and other healthcare workers? Obviously, the system is overloaded, doctors and nurses tired from so much, problems and people coming into the emergency room. Is it frustrating when people refuse to comply with the protocols that will keep everybody safe?
Honestly, it is. I hear about people being, tired of mandates or wearing a mask and whatnot. I'm tired of, going to work and pronouncing another patient dead because they were unvaccinated and passed away from COVID. I'm tired of having to tell the heart attack patient that because a hospital I might work at doesn't have a cardiologist, that they're going to have to wait there for 12 hours until we can find them a bed somewhere else. And they're not seeing a cardiologist in that time. And so that's frustrating. Those are all things that we should not be dealing with 2 years into this, especially when we have 99% of the tools that could prevent it. I think, we, as I mentioned earlier, are headed in the right direction when it comes to metrics, but we're not there yet. We need a few more months of, some of these mitigation measures to make sure that our system catches up and is repleted both with equipment, with staff, with mental energy, essentially, and so that we can get some of that burn off of our hospital systems that has been there for the last 2 years.
Yeah, that must be so difficult for you, doctor. I'm also wondering where we're at with the latest strain, because for a while we were keeping track, Delta, Omicron, this one, that one. What strain are we at? Or is there any coming down the pike? Are these other ones under control now? Where can you tell us we're at when it comes to these different strains that have been coming forward?
Absolutely. So right now, Omicron is the predominant strain, globally, and in the United States, we have this subvariant that we've all been hearing about. And kind of like with Omicron, three questions that I ask and that most scientists ask is it more transmissible? It appears to be about 30 or 40% more transmissible. Is it more deadly? And the initial indications are probably not, although we need to see a little more data around that. And the reason for that is in certain places in Europe and Africa, it is becoming the predominant strain there, and we're not seeing an increase in hospitalizations or deaths. And then the final kind of question is, do our vaccines work against it? And the initial indications, once again, because of not seeing a massive surge in hospitalizations in those areas or deaths, is that it does. We still need to learn a bit more about it before we can make definitive conclusions on those things. But right now, as things kind of start to get better, we need to refocus on ensuring that we get vaccines out to the entire globe and we vaccinate those in our country, because this is when we forget about that, and then the next strain comes along and we're like, what could we have done that would have been different? And right now is the time to double down on those measures and those policy kind of measures to make sure that we don't end up in that same situation in a few months all over again.
Yeah, we don't want to go backwards. Do we just need to learn to live like this with the flu every year? Is that where we're at now?
So initially, we will get to a point where we will, take personal risk and learn to live with it. And we will learn what our personal risk tolerances are in terms of, wearing a mask in certain situations or not going out during the winter, whatever the case may be. We're not there yet. Right now, we still need to all, take the most measures possible to decrease the high level of community transmission we have. I think come late summer, early fall, hopefully without any more variants coming down the pipeline, we will get to a place where we will, be somewhat comfortable and be able to do a lot more of the things that we were able to do a couple of years ago.
Okay, we'll end on that positive, optimistic note. Thank you so much for being with us today, Dr. Owais Durrani from Houston, Texas. Take care. The pandemic has cost restaurants and bars over $280 billion in sales, and that's what a report from the Census Bureau shows.